Randomized trial of medical versus surgical treatment for refractory heartburn. Definition: heartburn that persists despite proton pump inhibitor PPA treatment is a frequent clinical problem with multiple potential causes. Treatments for PPA refractory heartburn are of improving efficacy and focus on controlling gastroesophageal reflux with reflux reducing medication, e.g. baclofen or anti-reflux surgery or dampening visceral hypersensitivity with neuromodulators, e.g. disopyramide.
Hi, I'm Michael Lightman, Chief of General Surgery at Beth Israel Medical Center in New York. I'm going to speak to you about gastroesophageal reflux disease, or GERD. Gastroesophageal reflux disease is a common condition in which the stomach contents, either food or liquid, leak backwards from the stomach into the esophagus. This action can irritate the esophagus, causing heartburn and other symptoms. When you eat, food passes from the throat to the stomach through the esophagus. Once food is in the stomach, a valve comprised of a ring of muscle fibers prevents food from moving backwards into the esophagus. These muscle fibers are called the lower esophageal sphincter, and it acts like a valve. If this sphincter muscle doesn't close well, food, liquid, and stomach acid can leak back into the esophagus, and this is called reflux or gastroesophageal reflux. Reflux may cause symptoms, or it can even cause damage to the esophagus. The risk factors for reflux include alcohol, hiatal hernia, which is a condition in which part of the stomach moves above the diaphragm. The diaphragm is a muscle that separates the chest and abdominal cavities. Other risk factors include obesity, pregnancy, connective tissue diseases such as scleroderma, smoking, and other conditions. Heartburn and gastroesophageal reflux can be brought on or made worse by pregnancy and many different medications. Such drugs include anticholinergics, typically used for seasickness, beta blockers for high blood pressure or heart disease, bronchodilators for asthma, calcium channel blockers for high blood pressure, dopamine active drugs for Parkinson's disease, progestin for abnormal menstrual bleeding or birth control, sedatives for insomnia or anxiety, and tricyclic antidepressants. If you suspect one of your medications may be causing heartburn, speak with your doctor. Never change or stop a medication you take regularly without speaking with your doctor. More common symptoms include feeling that food is stuck behind the breastbone, heartburn or a burning pain in the chest area, again underneath the breastbone, increasing by bending, stooping, lying down, or eating, more likely worse at night, relieved by antacids, and nausea after eating. Less common symptoms include regurgitation of food, cough or wheezing, difficulty swallowing, hiccups, hoarseness or change in voice, or sore throat. You may not need any tests if your symptoms are not severe. However, if your symptoms are severe or they come back after you've been treated, one or more tests may help diagnose reflux or any complications of reflux disease. Such tests include upper GI endoscopy, which is often used to find the cause and examine the esophagus. The doctor inserts a thin tube with a camera on the end through your mouth. The tube is then passed into your esophagus, stomach, and small intestine. Other tests include upper GI barium x-rays, continuous esophageal pH monitoring.
Application in nursing. Patients who were referred to Veterans Affairs Gastroenterology Clinic for PPA refractory heartburn receive 20 mg of omeprazole twice daily for 2 weeks and those with persistent Heartburn underwent endoscopy, esophageal biopsy, esophageal manometry, at multi-channel intraluminal impedance pH monitoring.
When you swallow food, it travels through a tube called the esophagus. The esophagus leads into the stomach through a hole in a sheet of muscle called the diaphragm. There's a round muscle at the bottom of the esophagus that works like a valve. The muscle relaxes when you swallow, allowing food to pass into the stomach. Certain cells in your stomach, called proton pumps, release acid to help digest the food. The lining of your stomach protects it from the acid. The esophagus has a different type of lining, which looks like it's made of smooth tiles. The valve is designed to close tightly after you swallow, so nothing comes back into the esophagus. Your diaphragm is also meant to pinch securely around the esophagus, closing off the opening to your stomach. It's normal for a small amount of acid to occasionally splash into the esophagus. This is called reflux. That word means flowing back. A small amount of reflux doesn't usually cause any harm. But if acid splashes up into the esophagus over and over again for years, the esophagus can be damaged. There are several reasons this might happen. It's not uncommon for the valve to become weaker, so it doesn't close tightly. That allows acid and partially digested food to come up into the esophagus. Sometimes the diaphragm weakens around the esophagus, allowing the hole to become larger. This hole is called the hiatus. When it becomes larger, part of the stomach may bulge through it. This is called a hiatal hernia. The hernia may cause the esophagus and the valve to move up. In that case, the diaphragm is no longer reinforcing the valve. That makes it more likely that acid will get into the esophagus. When acid and food splash up into the esophagus repeatedly, it's called gastroesophageal reflux disease, or GERD. Gastro for the stomach, or gastric system. Esophageal for the esophagus. Mayo Clinic's Division of Gastroenterology.
Pros and cons. Pros: does not limit belching and vomiting. Direct post-operative dysphagia rate is reduced. Reduced bloating rate. Cons: limited in using MRI, magnetic resonance post-operative, foreign body at the EGJ esophagogastric junction.
Watch this short video to the very end. Now, let me tell you that I'm extremely hard to please when it comes to this sort of thing. Since I am satisfied, I should think that you would be too. Anyway, let's go over the good points and the hard points that I found in this product. If you would, please take the time to evaluate these points very closely, because at the end of the day, the decision of this program access is really going to be entirely your decision. So let's begin with the good points, shall we? This is an online download. You will get instant access to your product. There's no waiting, ages and hours for the item to be shipped to you. This is a permanent solution. There's no need for medication, drugs, countless visits to the doctor. It's a very affordable program. Additionally, it is one investment that will just reap many rewards over time. The product has a 60-day money-back guarantee, but you'll probably never use this guarantee, right? Simply because the program works so well. But just in that case, there's zero risk for you. The customer support that they offer is really awesome. You will also receive lifetime updates of the product. Now, as you can guess, it just doesn't get any better than that. You must follow the advice and the guide consistently to see the results, okay? That's important.
It's just one of the the darker sides of the product. It's not an overnight miracle cure. It's going to take some time, but once you do this and you put the plan into work, the results are permanent, and that's good, right? This is a comprehensive guide. There's plenty of quality content and unique information that you're just not going to find anywhere else. People don't share this information. The flip side to this is that people who don't really like reading will need to get a little patience to read through the entire guide. But trust me, it's really worth the effort. There's no peer support group with this program. That's a pity, isn't it? Because getting encouragement from others would really help to keep you motivated and on course. Now let me tell you about the gift that I was making reference to at the beginning of the video. The 60-day money-back guarantee really helped me to decide to check it out. But before I
Use applied in Ecuador. Among 366 enrolled, most were excluded, resulting in 78 undergoing randomization. At 1 year, the primary symptom endpoint was met in a significantly higher percentage of surgery patients. 67% compared with the active medical group, 28%, or the control medical group, 12%.
Well, welcome to our webinar today. We're going to talk about gastroesophageal reflux disease, and we're going to talk about evaluation and treatment of acid reflux. So my name is Lisa Lin. I'm one of the clinical instructors at the UCLA Division of Digestive Diseases. And we're going to dive right into our talk. So just to give you a brief overview of what we're talking about today, gastroesophageal reflux disease, we also call it GERD for short. And we're going to go through some of these common questions. So what is acid reflux? Why does reflux disease happen? How common is it? What are the symptoms of reflux disease? How do I know if I have reflux disease? Why should I treat it? And how do I treat it? So here, this image here, this is a picture of the esophagus. So that's the tube that connects our mouth to our stomach. And this is the stomach, and this is the first part of the small intestine. So we're going to focus on this area here where the esophagus connects to the stomach. And as you can see here, there is a lower esophageal sphincter here. And you can think of that as kind of a little gate between the esophagus and the stomach. And our stomach produces acid, so we have a certain amount of acid in our stomach, and sometimes this acid can come up into the esophagus. So that's what we call acid reflux, right? It's when the stomach acid flows back up into the esophagus, which is that tube that connects between your mouth and your stomach. But we all have, at one point in our lives, experienced some episode of acid reflux, right? If we eat a really heavy meal, that can happen occasionally, and that doesn't mean we have reflux disease. So what do we mean when we talk about GERD or reflux disease? What we really mean are, chronic and frequent reflux events that actually causes bothersome symptoms and complications of chronic reflux disease. So why does reflux disease happen? So here, again, on this image, you see pictures of the esophagus connected to the stomach. And again, here is that lower esophageal sphincter that we talked about earlier. So any issue that happens with any part of this can predispose you to reflux disease and its symptoms and complications. So, esophageal dysmotility. So if your esophagus is not pushing liquids or food through down to the stomach as well, that can, make things stay in the esophagus longer, where acids stay in the esophagus longer, and that can cause symptoms of ulcerations in the esophagus and symptoms of reflux. You can have an ineffective barrier between the esophagus and the stomach. So, for example, if you have a hiatal hernia, which is where you have a little part of your stomach that herniates up into the chest, so that's, for a hiatal hernia, when you have that, again, this barrier between the esophagus and stomach gets compromised, so again, predisposes you to reflux disease. You can occasionally get transient relaxation of this gate, of this lower esophageal sphincter. So that's what we call transient lower esophageal sphincter relaxation. And sometimes in some people, that happens more frequently than normal. And the more times that gate opens, then of course there are more opportunities for acid to come up into the esophagus. You can also have abnormalities with your stomach. So, for example, in obesity, we have more, you have more central, if you have more central obesity, you have more pressure on the stomach, right? So it's all about a pressure gradient. If you have more external pressure on the stomach, again, that allows you to overcome the pressure in the esophagus more easily and allow more reflux to happen. Sleep apnea, if you wear a device at night that kind of is blowing air in, you can get more air into the stomach and increases the air in the stomach, and again, that can also predispose to more reflux. Sometimes you can have gastroparesis, or what we call delayed, it's delayed emptying of the stomach. So with any delayed emptying, you have more stuff sitting in the stomach for a longer period of time. So again, more likely for that stuff to come back up into the esophagus from the stomach. And very rarely you can have acid hypersecretion, which is where your stomach kind of secretes too much acid, and that causes some damage to the lining of the esophagus or reflux symptoms. So how common is reflux disease? And, the answer is that reflux is very common. 10 to 20% of people in the U.S. have at least weekly symptoms, and 40% of people have intermittent symptoms. So it's extremely common. I'm sure you all know someone who has symptoms of reflux disease. And what are some of those symptoms? So reflux disease can present in a variety of symptoms, but really the typical classic symptoms of reflux disease is heartburn and regurgitation. There are other atypical symptoms, so like chest pain, belching, nausea, epigastric pain, bloating, or laryngeal symptoms, which are, symptoms in the throat area. And reflux disease can
Conclusion. Among patients referred to Veteran Affairs Gastroenterology Clinic for PPA Refractory Heartburn, systematic workup Refractory PPA Refractory and reflux-related heartburn in a minority of patients. For that highly selected subgroup, surgery was superior to medical treatment.
The acid reflux strategy reviews. Although acid reflux is a common problem for many people, it can be very painful and has many serious consequences. This state is not as innocent as most people think. In fact, it can cause esophageal cancer if it is not treated. Terrible pains in acid and chest that cause acid at night. This happens when gastric acid flows back into the esophagus. Drinking water increases the pH of the stomach, dilutes the acid and removes the esophagus. Here I found a treatment guide for acid reflux, which requires a balanced production of gastric acid and better digestion. If you want to get rid of acid reflux as quickly as possible, it's important to find a good natural solution. This rating provides valuable information that can provide you with the help you need. The acid reflux strategy is a simple tool for most people. How does the acid reflux strategy works? This system shows what you need to do to change your overall health. Often the stomach is not just acidic. There are some changes in the diet. However, this should be a long-term solution. The guide is a solution that can be easily used in everyday life. In just 8 weeks, it offers a special way of eating and living. It also informs you how prescription tablets work, why you do not want them, and what are the symptoms of your body. All this information is effective and can help you better understand your situation. This holistic acid reflux strategy is completely different from the other treatments and can help men and women of all ages. Benefits of the acid reflux strategy. Less discomfort. According to the methods described in this guide, reflux symptoms can be reduced or even eliminated.